Hi, I'm Conor Meade, and we're here at the 2015 Canadian Science Policy Conference with Michael Kruse, Chair of the Board of Bad Science Watch. So thank you so much for joining us, Michael.
It's a pleasure to be here.
So why don't we start off? Why don't you tell us a little bit about Bad Science Watch?
Sure. So Bad Science Watch is a non-profit organization that is grassroots and dedicated to the advocacy of good science in public policy. We've been around for about 3 years now, since 2012. We're all volunteer, and we've been working hard to sort of promote the idea that evidence is important in making policy decisions at the government level.
Okay, excellent. So what are some of the major successes and achievements that Bad Science Watch has had over the years?
Sure, we've been working on a couple of different files. The one that's had the most impact, we think, is our Stop No-Sodes campaign, which was a campaign to engage public health professionals, physicians, nurses, public health advocates to speak out against the use of homeopathic vaccine alternatives, which have no evidence of efficacy at all, but which were approved by Health Canada. So we managed to get Health Canada to change the labels to be quite strong and to make sure the public knows that these aren't used for vaccines and that vaccinations are indeed a safe and important part of our public health program. Besides that, we've been advocating for better evidence use in the National Health Products Directorate, or the Natural and Non-Prescription Health Products Directorate, as it's called now, and Health Canada, the directorate who approves natural health products, and to ensure that Canadians are kept safe by high quality and effective medications.
Okay, so how did you get started with Bad Science Watch? What's the origin story, as it were?
Yeah, so I was one of the founders, along with my our partner Jamie Williams out in Vancouver, and I'd been part of some science advocacy work in the past, but there hadn't really been a national effort to bring people together and to create programs that had actual meaningful change. And so we got together, made a nonprofit, went through all the kind of steps to put that together. We were all new. I mean, I'm a paramedic. I'm not a business or involved in the nonprofit sector. So we just thought that there was a problem that had to be solved. And we decided to approach it in a professional and meaningful manner, and that's where we all came from. We gathered people from many different backgrounds. We've got software engineers and doctors and nurses and just interested members of the public to be volunteers. And so far, it's been a pretty great experience.
Excellent.
Yeah.
So what are some of your goals moving forward? Obviously, but maybe the situation has changed a little bit with the new government. What are some of your priorities as an organization in the coming years?
Well, certainly we're going to continue to pressure the Natural Health Products Directorate, the Non-Prescription Natural Health Products Directorate, to improve its regulations around natural health products, to ensure that there is an important an effective quality assurance program, which is one of the things that we've been talking about lately. You may have seen the piece on the Fifth Estate and Marketplace, CBC Marketplace was last week, that sort of highlighted the deficiencies in that program. So we're going to continue to work on that. We're also going to build on the success of our Stop No-Sodes program and start to promote and develop tools to help physicians and public health nurses more effectively communicate with their vaccine hesitant patients. There's a problem with low vaccination rates in certain parts of the country. There's certainly a large and we think growing population of people who are hesitant, maybe concerned that there might be some sort of conspiracy or that physicians are hiding information from them. We like to encourage people to get vaccinated. Certainly it's an important public health program. And we feel that as an organization we can develop programs sort of outside of the regular structures that help people communicate. Now that's one possibility. Certainly we're working on some strategic planning to sort of open up what our plans going to be for the next few years. But we're certainly going to stay on topic with natural health products to make sure Canadians are safe.
Excellent. That sounds like very important work.
Yes, indeed.
So looking up from the specific focuses of Bad Science Watch, what do you think are some system-wide, process-driven policy changes that we can make to implement evidence-driven decision-making at all levels of the policy process?
Well, we're very attracted to the UK model, which has a third-party, non-partisan parliamentary advisor to Parliament that comes up with best evidence for policies. I think that we'd like to see the establishment of an office of evidence-based policy development. So they would establish standards of evidence and help communicate those standards of evidence not only to parliamentarians but also to the public, which would allow the constituents to judge their representatives properly, and hold them to a standard, and hold them accountable when they use evidence to make their decision making. I mean, it's a reality that evidence and scientific evidence specifically is only one portion of the decision making process for members of parliament and the government. But it's important that the public understands how they go through this process and what evidence they rejected as well as what evidence they accepted. So we think that certainly we support the idea of a parliamentary science officer, somebody who's responsible to reporting to Parliament about scientific issues, but also someone, an office that's going to actually establish minimum standards to use for the use of evidence and what constitutes good scientific evidence as opposed to poor scientific evidence.
Okay, excellent. So one final question before we wrap up. Just for the benefit of all of our viewers at home, as it were, if we want to learn more about Bad Science Watch, maybe even how to volunteer, how to contribute, where can we find you online?
Certainly we're at badsciencewatch.ca, just all one word. They can certainly email us at info@badsciencewatch. We're on Facebook and Twitter if you want to find us there under badsciencewatch.ca. So we encourage people to let us know what they feel, and certainly we're always looking for volunteers. We're not a completely volunteer organization, need all the help we can get.
Excellent.
Great.
So as a quick follow-up to that, what kind of volunteer roles might you be looking for people who want to get involved?
People who are science-minded and interested in research. They don't have to be experts in policy or experts in healthcare, but somebody who's motivated to learn, somebody who's has some extra time to give the organization, and somebody who is committed to making sure that policies are evidence-based and science-based.
Excellent. Well, it sounds like a great organization.
Thank you so much.
Michael Kruse, Chair of the Board of Bad Science Watch. Michael, thank you so much for joining us.
You're very welcome.
It's been an absolute pleasure.
Thank you very much.
Cheers.